The World Health Organization is calling for a moratorium on vaccine boosters until at least the end of September to enable at least 10% of the population of every country to be vaccinated. Director General of the World Health Organization, Dr. Tedros Ghebreyesus, stated that there is a need for an urgent reversal from the majority of vaccines going to high-income countries to the majority going to low-income countries. He added that so far, more than 4 billion vaccine doses have been administered globally, with more than 80% to high and upper middle-income countries, even though they account for less than half of the world's population. The Director General says although all governments are working to protect their people from the Delta variant, the most vulnerable people should not be left out and remain unprotected.
So far, more than 4 billion vaccine doses have been administered globally. More than 80% have gone to high and upper middle income countries, even though they account for less than half of the world's population. I understand the concern of all governments to protect their people from the Delta variant. But we cannot and we should not accept countries that have already used most of the global supply of vaccines, using even more of it, while the world's most vulnerable people remain unprotected.
What we're calling for is, for at least the next 2 months, is a complete, global solidarity around the goal of catching up the rest of the world to, in terms of its immunization coverage. So the moratorium is all about, for those who've decided that they may want to use booster doses, et cetera, trying to put a hold on those policies until and unless we get the rest of the world caught up.
This is a really big decision about administering third doses to people who have already been vaccinated. And it's incredibly important that we're clear about what the data are, that the data are strong in supporting or in not in support of whether or not those doses need to be administered. If we're not really grounded in that clarity, we're going to be in a place where we have forever uncertainty about what actually should be done.